to the testing strategies for NBRC testing. Hopefully this will be a little bit helpful to you. These are just some strategies that have been proven over time just in general education, as well as some things that test takers will often use for board exams, not only just for respiratory, but for also other medical boards as well. So we'll go over some of the stuff in here that should help you prepare for the test and study for the test. Now I want to start this by saying, when you guys are studying, when you guys are doing this whole preparation for the board exams, be intentional about how you're going to study and how you're going to approach the exam. Now it is a long exam, as you know. It's a very long exam, both of them are. And the big thing here is just making sure that you know your pace. You know when you need to second guess yourself and when you don't need to second guess yourself. By the time you get here, you should know your studying strategies. Try not to vary too much from your comfort zone here, but be intentional, right? You're not gonna, if there's a sports team out there, their coach isn't just gonna say, okay, go out and practice, have fun, and then not have a goal in place of what they're going to work on in practice and what areas they need to improve on. So when you're studying for the board exams, when you're taking this class, make sure that you're intentional about how you are studying. Know what areas you are strong in, what areas you need to improve in, and work those areas. If you need to improve on your timing of the test, then improve on your timing of the test to make that a focus of one of your studying sessions. If you need to work on multiples, right, make that a focus on one of your studying session. Make another study session where you just use all different equations. Make another study session where you're looking at all the different clinical scenarios, right? You're putting it all together. So this is making sure that you are intentional about how you study for this exam. The more you are intentional, the more you write out a plan for how you're going to study for this, the better prepared and the more comfortable you're going to feel when you take this exam. And if you feel comfortable when you're taking the exam, which I don't know anybody that's ever felt comfortable taking the exam, but the more comfortable you feel because you have had these areas of preparation, the better your memory will do. You're not going to be in that fight or flight sense of brain, that lizard brain, that lizard brain that says, oh, I don't remember my higher ways of thinking. So the more intentional you practice, the better you'll do on the actual board exam when it comes around. So these are some strategies, and like I said, you need to be intentional about how you're going to study for this exam. Know your strengths, know your weaknesses, and just like doing a dance, you can't just watch someone do a dance and then be able to do it right away. You need to do it yourself repeatedly over time before you master it. And so studying for the board exams is one thing, and making sure you got the information down is one thing, right? You could actually absolutely have all the information memorized, but if you don't have it memorized to the point where you can actually do it in practice, then it won't be worth much when it comes time for the exam. You need to be practicing the exams, the practice exams, the way that you're going to take the actual board exam. So sit down, prepare for it like it's the actual board exam. You want the board exam, by the time you get there, by the time you show up to that room to take that board exam, you want it to feel like you've been there before. You want that room to be like, oh, I've sat down and I've done a whole test intentionally with as much focus as I can like this before, with just a pencil and a paper, right? So be intentional, right? That's my big key for this first slide. So just get those strategies down, but understand that you need to practice. The more practiced exams you do, the better you will do on the big exam at the end. Studying is not just the only part of this. You need to also practice taking the exam. All right, so the first thing that we'll talk about here is being positive. So when you're looking at this exam, it can be very overwhelming. You spent almost 2 years getting ready for this exam, and so how you focus on it is going to be a big deal. So The idea going into this is understanding, hey, I prepared for this, I'm ready for this, I've studied for it, and I practiced doing this exam multiple times. So you can't go in with a deficit-based mindset. Now, a deficit-based mindset puts you in that stress cycle of that lizard brain thinking where you cannot recall a lot of information. So you need to find a way to be positive during this whole test, and that's or during this whole preparation and during the test itself. Understand, hey, I got this, or hey, I understand this, or hey, I don't understand this, but I know I'm going to come back to it, right? You cannot be in a deficit-based mindset and do as well as you would be in an asset-based mindset. Know that, hey, I see an equation, I'm good at equations, I got this. Or hey, I see a pharmacy question, I'm really good at pharmacology, I got this, right? So I need you to think positive, be in an asset-based mindset. So the more you doubt yourself, the worse you will do here, right? You cannot be going into this with that stress mindset. You're going to have stress preparing for this, but that's the whole idea, is to stress you preparing for it, and then when you get to it, your body is ready. You're good to go. You're conditioned for the big test. Right? It's a big jump, but you got to believe in yourself, right? We're here for you. Did you do the best you can? When you were taking these practice exams, when you're taking the practice test, when you're doing your own little workbooks, I suggest making a workbook for the exam, but when you're doing all these practice things, did you do the best you could, or did you sort of click through the answers just half-heartedly, right? Understand, the more that you put effort into the practice, the better the end result will be. So every time you take these practice exams, take it seriously. Get a good night's sleep beforehand. Eat a good breakfast. Eat a good meal beforehand. Prepare for it like it's going to be the actual exam. Like I said, the more you practice this as if it was the real thing, the better you will do. So make sure you put effort into even the little practice exams. The more you put that effort into those, the better you will have comprehension as well. Your actions usually will follow your beliefs, right? If you accept defeat, that's usually what you'll get. And this is one of the things that I truly believe in, right? I would precept students, they would go to do their first blood gas, and they'd be like, I'm going to miss, I'm going to miss. I'm like, yeah, you are, with that mindset, right? Because then they're going to mess up. Their brain's going to block them. They're in that deficit-based mindset, and it's going to block them from knowing what they know. I hope that makes sense, right? It's going to stop them from getting to where they need to go. And so when you're approaching this, make sure that you understand that, hey, I prepared for this the right way, I practiced this the right way, and now I'm ready to take this the right way. So get into that asset-based mindset. What am I good at? What have I worked on? I've worked on this. I've worked on every category that's on this NBRC exam, so I'm ready to go, right? I may not be perfect, but I'm ready to go. So be in that asset-based mindset. Don't waste time worrying about what the test is going to be like when you get there. Focus on what you can control, right? You cannot control the questions that you will get, right? The questions are randomized. This type of test that you get will be randomized as far as like the difficulty level and everything. So when you're looking at this, don't be worried about the questions that they're going to throw at you. Prepare for what you know is the content that is on the exam. Do the best you can to get ready and focus your energy on being productive with getting through that information that the exam covers. So that way your energy is better utilized actually preparing for the test than it is just on straight worrying and anxiety and going into that lizard brain mentality. So focus all your nervous energy into what you can control, which is how you prepare for the test. So right, like I said, nervous energy, it's okay, that's natural, it's normal, but focus it, right? Harness that and turn it into something productive, right? The time leading up needs to be focused. Like I said, you need to have a plan for how you're going to study. Hey, at this study session, I'm going to do 45 minutes on and then 15 minutes off, and I'm going to do 45 minutes of equations and then 15-minute break to get my mind off of that whole situation and on something else. Then I'm going to do another 45 minutes and I'm going to focus on blood gas interpretation, or I'm going to focus on calibrating equipment, or I'm going to focus on troubleshooting equipment, right? So this is where you're going through each of the individual categories and you're doing that breakdown, right? So you need to focus, right? Don't waste your time on just nervous energy for what the test may ask you. Focus on what you can control. All right, so always be prepared. I love the good Maria and being confident here. So review prior to the test. So this is waking up that morning or whatever time that you would normally wake up, and getting ready and just going over the basic bullet points. You shouldn't be cramming right before the big board exam. You don't want to stress your brain out, right? Cramming stresses your brain out. You want to review all the bullet pointed notes that you've made that morning, right? So we're always going to make sure that we're reviewing before a test, but we're not cramming before the exam, right? There's a big difference in mentality. There's a big difference in your stress cycle if you cram before a test versus just reviewing before a test, and hopefully you hear the difference there. So regular periodic reviewing is the most effective way to get something in your long-term memory bank, which is where you want it for the test, because let's say you do get stressed during the test, right? And that's normal, it's natural, it happens to pretty much everyone. You get stressed in the middle of the board exam. Well, when you're in that lizard brain, that stressed loop of mentality, then you're going to lose your short-term memory. Well, if you just used your short-term memory to cram everything before you went in to take that exam, you're not going to do well. You're not going to recall much information. But if you look at when you're thinking of taking the exam, schedule back a couple months, take 15, 20 minutes, do a 45-minute session a day, right? Something like that where you just review every day for 45 minutes at 7 a.m., right? Whatever, pick a time, right? 9 a.m., 10 p.m., whatever it is, pick a time and do it on a regular basis. Now, there's a book called How We Learn by Benedict Carey, and it actually talks about 10 minutes a day is worth 9 hours the night before. So that's where you need to have developed this over time. Start working on it now. Don't wait till the week before the board exam to start studying for it. Start now. Think about when you're going to actually take the exam and schedule the exam, and then make a focused plan of what you're going to study, when you're going to study, and make sure that you schedule that time out. Set a reminder in your phone, right? All your guys have little smartphones that have reminders and all that stuff. Do it. Set it. Right? Be that regular periodic reviewing is going to be the most effective way to remember during a stressful situation, right? It's that stressful situation where you want this stuff in your long-term memory. All right, so when you're looking through the study materials, like your Persing review book, or you're going through the practice exams, or you're going through my review guide, right? What did the materials emphasize, right? Did they emphasize, hey, interpret this blood gas? Right, acute respiratory failure with mild or moderate hypoxemia, right? So did it emphasize those things, or did it emphasize more patient scenarios? What did the materials emphasize going into this? So look at this is where I have you guys look at the content areas that the test covers, and it's on the outline on the NBRC hospital, not NBRC hospital, on the NBRC website. So that way you know what the NBRC hospital wants you to know. You know that they're going to ask you about this section on the exam. They know they're going to ask you about this section on the exam, and these outlines tell you exactly how many questions out of that content area are going to be on the exam. They also tell you what type of questions. Is it going to be a recall, like, hey, how many segments are in the right lower lobe? Right, that's a recall question, right? You either know it or you don't. Or is it going to be an application? Hey, you're doing a bronchoscopy, you see 5 tunnels on the in the view screen, which lobe are you looking at, right? That's a whole application question, right? Because they're taking knowledge and being like, okay, what do I know about the lobes? Okay, I know there's 4 in the left upper, 4 in the lower, 3 in the right upper, 2 in the middle, 5 in the lower. Okay, so we know we're in the right lower lobe. So it will tell you if it's a recall versus an application. They'll give you a scenario. You got a 56-year-old male. They need to be put on mechanical ventilation. They weigh 80 kilos. They're 5'9". What would be their initial vent settings, right? So that's going to be an application. It's not a recall question. They're saying, okay, apply information that you know will be appropriate for this patient. So they even tell you in these outlines, application versus recall. Okay, so be prepared for the types of questions that they'll also be asking you. So just knowing random facts may not be enough for the test. That's where you should start to put scenarios behind some of this information as well, because most of these questions on the outline, when you guys look at these, and I strongly suggest you look at the outline, is going to be based on not recall, but application. Right? This is where you need to figure out what you work best with. Do you like charts? Do you like flashcards? Right? Do you like other learning aids? If you're a person that has one of these that works best for you, use it. Right? Pick it and use it. I wouldn't say start something new now, right? You should know what works for you, unless cramming you think works for you. That I do not recommend that, obviously, because you'll be in a stress state and you're not going to do so well. But you should know by now what works well for you. If flashcards and charts and learning aids don't work for you, then there's NBRC workbooks, right? You can create your own workbook. Look at the content outline. Ask questions. Hey, what are the 4 indications for bronchoscopy? If my patient has this type of blood gas and they're on the ventilator, what setting would I change, right? So create your own workbook, and then you guys could also create workbooks together with study buddies as well, right? You guys can form study groups too, leading up for this and getting ready for it. All right, practice test, like I talked about before, you're not just going to watch someone do a dance and think that you could now go out there on the dance floor and execute it perfectly, right? That's not how it works. Yeah, your brain may process the information so you know in general what happens, but when you try to get your body to actually execute what you just seen, it's not going to work very well. You need that connection between what's in the brain and how to put it out into what you're actually physically doing. So when you're preparing for the test, you need to actually prepare for it by not only just reading the materials that the test covers, but also practicing taking the test with that information. So you need to apply that information that you're studying to the test. Now, that book, How We Learn by Benedict Carey, talks about how 50% of your study time needs to be in recall. That needs to be applying what you're reading. So you can't just read a chapter and be like, I'm good to go. No, when you're reviewing it, you need to actually have 50% of your study time needs to be actually reading the information that you need to read. The other half of your study time needs to be trying to figure out a way to recall that information, trying to apply that information. So 50% of your study time should be in recalling information or applying information. The other half of it should be spent reading over the information or listening over the information if you have the downloads for it. So take the practice test, pretend they're the real thing, get your mind in there, but make sure when you're studying, right, you're reading through the material, you're listening through the material, and then you also spend some time recalling the information. That's flashcards, that's workbooks, that's doing your learning aids, whatever it is, blanking out your notes. That's working hard to make sure that you're doing that recall portion. Like I said, you can read as much as you want, but if you don't start putting it into application as far as testing goes, it's not going to be as helpful as you think it would be. All right, deep, slow breathing will help relax the nerves. Here you see the picture of Maria. She has a lot of confidence, but she probably had a lot of nerves going into that whole Von Trapp situation. So when you're looking at this, that slow, deep diaphragmatic breathing, remember the diaphragm massages the vagus nerve, and that actually slows down your heart rate, decreases your blood pressure. It can help take you out of that stress loop. If you're in the test and you have that stress loop, or you're right about to go in to take the test, do that slow, deep belly breathing, that diaphragmatic, bronchiatic breathing, right? That yoga breathing that helps that body calm down, that helps the blood pressure decrease, that helps the heart rate decrease, that helps you get into your more relaxed state of mind, which means you can then start to read more carefully the questions and resolve the situations more effectively as well. So that deep, slow breathing could help. The big thing here, preparation and confidence usually are great preventative measures when you're looking at this. I need to be prepared, and I need to look at my assets going in. Hey, I prepared for all the calculations that will be on it. I'm prepared for the multiples that'll be on it. I'm prepared for both recall and application questions. So understand that you're prepared for it. You were intentional about this. You practiced the actual execution of the information, right? Understand that you're ready to go, right? Be confident, be asset based when you're going in there. You cannot have a deficit based mindset going in. All right, so this is the 5-day preparation plan. You should start studying now for the boards if you have not already. The 5-day preparation plan is just in general for general education purposes. That's out there, so this is not something new that I created at all, but I want you guys to sort of have this information of just how you do a stepped approach to the exam. So you can do a 5-week preparation, right? So make something, be intentional, write it out. Actually write it out by hand or whatever, post it on your fridge, post it on your mirror in your bathroom, post it all over the place, write out the plan, put reminders in your phone every day to do this plan or to execute this plan. So before the test, so this is further out, this is where you read the study material. Remember, this is something where you have to spend half of your time reading the material, the other half of the time you have to spend it recalling or applying the material. So think of a case study where they might give you a blood gas and they might give you some blood values, like a hemoglobin and hematocrit. They might ask you to calculate something, right? So think of a way that they could apply this not only in a recall question, but also in, hey, a patient scenario situation that they probably will have you do. So not only do you need to read the study material, right? Spend half of your time reading the material, the other half trying to recall that information. If you can recall it from blank memory, right? Especially with an application question, think of how good you're going to do by the time you see a multiple choice question, right? So trust me on this, right? I'm here to help you out. If there's any handouts or diagrams that you created or that you've seen in the study material, look at those. Look at those flowcharts, look at those things. They're very important, especially if you're looking at all the equations that the test can cover and things like that. Any important information that you need to know that the test is, that the material stresses, that's a highlight information right there, right? And so that's where you're going to make a process where you're going through and you're prioritizing what are the key points that this material is going over. What are the key points of indications of bronchoscopy? What are the key points of indication in non-invasive ventilation? What are the key points of invasive ventilation? What are the key points of vent changes? What are the key points, so on and so forth, right? So hopefully you're getting this where you're creating your own study guide, where you're reading the material and you're finding a way to apply it and recall it as well, right? Don't just read the material, find a way to apply it. 50% should be applying. Day 4, so as you get closer to the test, this is where you're creating your own study material. Like I strongly recommend, use blanked out documents to practice what you need to know, right? So you're going to find all your notes, look at all the bullet points you made, look at all the highlighted information, and then rewrite it as blanked information. just like all my PowerPoints from semester 1, right? You guys hopefully remember the torture that I did where I had you fill in all those blanks during those lessons, right? That's to get you to sort of find a way to remember the information, to recall the information from route memory. That's to get you to the point where you're applying the material, you're not just reading it. So that's making your brain actually work hard to recover it. The harder you make your brain to work to recover something, the more it's ingrained in your memory. I'll repeat that again. The harder you make your brain to work for something, the more it's recalled in your memory, right? And so that's something that's ingrained in your memory. So that way, when it comes time to the exam, even if you're in a stressful state, you'll have a lot better recall of the information. Workbooks, worksheets, completion questions, these are all great assets to help you prepare for this exam. It's the people that don't do this part, that don't do the recall part, that don't do the application part, that won't do nearly as well. Like I said, you could have all the book knowledge in the world, but if you don't know how to apply it, then it's not going to work well for you even for this exam, right? Because a lot of this exam is not recall, a lot of it is application. So look at the application. Where does this lead? So this means making your own worksheets, making your own completion questions, doing whatever it takes for you to recall the information, right? So make sure you're working to recall it. All right, so as you get closer, rewrite the information using as fewest words as possible. This is what I call simply stated things, right? In your Egan's book, or in my Egan's book, when I was in respiratory school, there's these little gray boxes that used to say simply stated this, or simply stated that, right? And so they're like, simply stated, an E tank and an H tank are a factor of 10 from each other, right? If one is on 10 liters a minute, it'll last an hour. The other one's on 10 liters a minute, it'll last 10 hours, right? So it's just doing a simply stated scenario, right? So instead of this whole equation that you would have to do for, and that's just the example I used there, instead of this whole equation that you have to use for tank duration, I know that if I run an E cylinder at 10 liters a minute, it will last 1 hour. And that's just the simply stated part. So then I can logically figure out if they give me an H tank and it's on 10 liters a minute, I'm like, oh, I know it's a factor of 10. Okay, so it'll last 10 hours, right? And so this is just you rewriting the notes, making it as simple as possible. The more simple you make it, the easier it is to memorize, the easier it is to recall under a stressful situation, right? Down here, this is one of my favorite quotes of all time. Einstein said, if you can't explain it simply, you don't understand it well enough, right? So if you are going through all the notes, all the NBRC outlines, right, and if you can't simply state the indications for this, or if you can't simply state what the A to A gradient is telling you, or you can't simply state what these things are looking at, then you probably should review it again, right? All right, review your written notes, your rewritten notes, at least twice per day is what they recommend. So as we're getting closer, right, we're on day 3, right, or week 3, or whatever plan that you're planning to use here. Review your rewritten notes at least twice per day, right? Get that into your brain. Like I said, don't just reread them, right? But also spend time recalling them or applying them as well. So reviewing doesn't mean just rereading. Reviewing implies not only reading, but also application as well. Whew. Hopefully you're having fun so far. All right, as you get to the day before, think about different ways that they're going to ask the questions or the information. So this is week 2. This is your workbook, and then this is you making a scenario or using practice test scenarios to help you think of like, oh, okay, this is a way that they asked me about what a normal CO2 is, right? I remember a question when I took the boards the first time where they gave me this whole scenario, and this patient's this, and they're this tall, and they weigh this much, and they're in with COPD and all this other stuff, and like this is their blood gas, and they were asking which of the following would be their CaO2, and I'm like, well, all the values going into the equation are normal, so I don't even need to do the equation. The question's asking me, what's a normal CaO2? That's it. That's what all the question was asking. They're trying to distract me with all this other stuff. And really, they're just asking, hey, what's a normal CaO2? Here are normal values. What's a normal CaO2? And so that's something that I want you guys to start looking at. What are different ways they're going to ask these questions? And hopefully we prepared you for that enough. But when you're looking at these questions, ask yourself, what are they really asking me? What's this question really looking at? Like I said with that CaO2 question, they were just asking, do I know what normals are? And that's it, right? It was actually more of a recall than an application question, but it was actually technically an application question, right? So think of different ways they might ask you to remember this information. It might be cleverly disguised, right? Like I said with that whole scenario, but really, what is the question asking you? So write out these questions and answers and start practicing them, right? What are different ways they can ask you about the eta gradient? What are different ways they can ask you about troubleshooting or cleaning equipment? What are different ways they can ask you about therapeutics, right? Start looking at what are different ways they can sort of hide questions, right? Cleverly hide those questions. So that way you can spot them when you see them. Like, oh, Derek prepared me for this. Stacy prepared me. Justin prepared me, right? Gina prepared, right? We're prepared because you've sort of seen us disguise these things before NBRC style, right? All right, so the day of the test, the big thing here is review your rewritten notes from the third week or from whatever. So this is you keeping on reviewing your notes, reviewing your notes. Remember, reviewing doesn't mean just reading. It also means finding application, recalling them as well. So you're reviewing these. You're not stressing yourself here. You're just going back through them. You're making sure your memory is still cycling through these. You're making sure they're still in your memory. You're not stressing yourself, right? Review the questions, review the answers that you worked with different ways to ask this material. Right? You can do this while you're eating. You can hopefully have some, whatever your family support system is, or your loved one's support system, or you can even record them on audio and play them back to yourself. Right? Things like that while you're driving, where you're literally listening to yourself, read yourself questions, read yourself answers, right? Things like this is just going to help you. Like I said, try not to get yourself into a stressful state the day of the test. Just make sure you just quickly review some of the basic things, some of the main points, some of the simply stated things, just to help you refurbish your memory right before you go in. So just before the test, anything that you had difficulty remembering. I remember I had difficulty with one of the board exams, I think it was the RPFT, remembering the calibration pHs for the blood gas machine, and it was like 6.84 or 7.38, and I kept mixing up the decimals there. So I was like, is it 6.84 or is it 6.38 and then 7.84? Right, and so I had to always look at that because I would always transpose those two, right? So that's something I would look at right before I go in because my brain, for some reason, could not get it straight. I knew that the pH was 6 and 7, right, for respectively for the 2-point calibration for the ABG machine, but I couldn't remember which one was the 0.38 and which one was the 0.84, right? So that's something that you need to start reviewing and understanding. Okay, put a star next to anything that you have sort of those issues with before you go in, so that way, okay, I remember 6.84, 7.38, right? You know that you remember it when you're going in. Because you're like, I'll put that in my short-term memory bank because for some reason it did not sink into my long-term memory bank there. So anything you have difficulty remembering, that's something that you just peek at one more time. So make a little side card, a 3x5 card of like things you have difficulty remembering, and just write that stuff down there, right? Okay, so how do you prepare your body physically for this? So get as much sleep as you can. This is why I want you to use the practice exams and practice like it's the real exam. So as much sleep as you can beforehand. So do something that's going to make you very sleepy, right? Whether it's going out and running 7 miles or whether it's, doing strenuous yard work, or whatever it is that's going to make you sleep really well, as long as it's legal and healthy to do. Go ahead and do that. Get something that will make you your body to the point where it wants to get that sleep, it wants to get that rest, because otherwise, if you're in that stressful state of mind, you're not going to be able to do it. So release some of that night before stress with an activity or something that gets your mind off of the situation, because you want that good sleep. If you don't get that REM sleep, you're not going to be ready for that test. So that REM sleep will help you recall that information much faster and easier. Make sure you're eating good nourishing meals for food. Yeah, Red Bull and Fritos don't count. Just saying, you're not going to feel so well for that test, right? You need to prepare for the practice exams like you're preparing for the real thing. Make sure you eat good, nutritious stuff, good brain food. Get some salmon, whatever it is. Get some good brain fuel that you're going to be eating. Don't eat some junk right beforehand, or don't feel in that carb coma. Don't get into that Thanksgiving syndrome right before you're taking the test. Not only for the practice test, but also for the real test as well. So yeah, no, none of those things. All right, make sure your brain's ready to go. All right, be realistic when you're taking the test. So having or showing sensible idea of what can be achieved or expected. Don't go into it thinking you will know every single bit of information that it's asking you. Understand, hey, there'll be a question, I don't know what it's asking, or hey, I don't know what the right answer is in this situation. That's okay. You should not be thrown off by that, because now you know not to expect to know everything in the test, right? Remember, some of these questions in the test are actually test questions. They're not actually counted questions. They're trying to see how well this question is read, comprehended, and applied by a student before it becomes an official graded question. You don't know which ones those are. So you need to have an idea that, hey, some of these questions may not make sense at all, or are written differently than what you're maybe used to. That's okay. Don't let it throw you off, right? So have an idea going in, okay, I understand that I may not know every single question on here. That's okay, right? I'm prepared as much as I can. I'm ready to go. And if I don't notice a question right away, I don't know the answer right away, I'm going to move on, come back to it, right? So questions may not be prepared for. That's okay. If you see it and it puts you in a state of stress, right? So you're taking the first question, you see question number 1, and it's this ginormous equation, and it's looking like it's asking you to calculate the mass of the sun on a Thursday on a vernal equinox or whatever it is, right? Then if that stresses you out and puts you in a stressful state of mind right away, go past it. Right? Select B, right? Whatever it is, and then go past it or skip it, and it'll come back to it later. But right, go past it. Don't start off in that stressful state, right? So answer the ones that you absolutely know, then answer the ones you mostly know, then answer the ones you don't know, and the ones you absolutely have no idea, use your gut. And if that doesn't work, always pick the same letter, right? So we'll go over that there. But skip it, come back later. Don't go into that stressful state of mind. You don't want to be in a stressful state of mind during this test as much as possible, right? We want you in that as relaxed and calm state of mind if we can. Once you come back and see the question, after your brain's had some chance to warm up with other exam questions, then you actually might see it makes more sense, right? Your brain might actually be warmed up to what this test is asking you. So that's what you could be looking at there. And you're like, okay, now I understand what this question's asking me. I know the answer is D, right? And that's one of the things that you will be looking at there. All right, some more general strategies. Remember to pace yourself. This is where the practice tests come in very, very handy. You'll know your pace, right? This is why I want you to put like a little stopwatch on yourself, a little timer on yourself. They make watches that have timers in them. I know people with watches, right? So a little stopwatch, things like that. So make sure that you pace yourself. Make sure you know your pace during your practice exams as well. So that when you get to the real exam, if you start answering question after question after question, If you start going too fast because your brain's in a stressful state, you know to slow down. You know your pace, right? This is just like one of those marathon runners. They have to know their pace. They're not going to come out in a dead personal record sprint and end up finishing like they normally would. They need to know their pace. They need to know what they're set up for. So know your pace with the test. This is why taking multiple practice tests intentionally will help you out. Know your testing pace. Know that I should take some time, slow down on this question, because initially it looks too easy to be true, and sure enough you missed an absolute statement, or you missed a little key word here and there, right? If you took your pace, if you knew your pace, you might actually have done a lot better. So a lot of times people will pace themselves faster for the actual board exam. And so my challenge to you in the practice exams, like I said, take it intentionally, take it like it's the real board exam, read it slowly, make sure you understand your pace, make sure you know your pace. Now I'm not talking about take as much time as you want on the whole exam altogether, but I'm just saying to know your pace, know if you're going too fast, know if you need to take a pause and reread the question or reread the answer selections, so that way you know you're not missing something, right? A lot of people tend to miss things. So reading slowly, and I mean read it slowly. You're going to miss something like an absolute statement or a qualifying statement that's going to cause you to miss that question, right? So be careful. So what is the question really trying to ask is ultimately one of your study techniques, right? When you're looking at the test and you read this whole ginormous paragraph of a question, right? This ginormous question, it has all these blood gas values and it has everything in there, and you're like, what is going on with this question? You read the answers, you're like, oh, well, the answer is just asking me to calculate a CO2, and then I'm looking at all the information going into the CO2, and all of them are normal, then I know the answer is normal. So one of the ways that you could look at what is this question really trying to ask, if you see a paragraph question, right, you know that these questions give you stress while saying a whole scenario. Here's my suggestion to you. You see this whole scenario that gives you stress, just look at the answers first. So go down, look at the A, B, C, D, right? Look at those answers first. Okay, now I know where this is going, right? It's just like going to one of those restaurants where they had the kids menu that had the little maze on it, and you start at the finish area and you work your way back to the start area, right? It's a lot easier that way, right? So you're looking at where this is going. Where is this question leading? So when you go back to read what the question is asking, you sort of know what clues to look for in the question. So if you see a paragraph, situation, question, right, and that gives you stress, my suggestion is try to find out what they're trying to ask. So look at the answers, and then go back and read through the whole paragraph, knowing that you're going to have to extract data that will relate to one of those answers. Okay, that is a way to avoid stress in this whole paragraph of a scenario. What is the question really trying to ask? Okay, now I can extract the data I need to answer this question. I don't get distracted by how many kilos this patient is or how tall they are. If that's not part of the answer is just asking for a CO2. Do I care about that information in the question? Absolutely not, right? So I'm going to cross those out. I know that I'm extracting different information. I'm not going to get distracted by doing an ideal body weight calculation. I'm not going to get distracted by something else. If I read the answers, I know where it's going, I start at the finish line and I work back, then I can actually be a lot more efficient with my timing and stress level on the test. All right, keywords, right? Keywords, both the question and the answers are going to be very helpful. Absolute words like none, never, all, always, every day, only the above are things that you have to worry about because those are usually wrong or false, right? They're always this and they're never this, right? Those are usually false statements, right? And so that's something to be prepared for. So here's an example. The result of Barney's study showed that all people suffer from SPAC. No people suffer from SPAC. Now this is just made up, right? SPAC never occurs in young people, or may be found in more in older people. So which one of those looks like it would be the correct answer, right? This is made up, but just based upon the absolute wording, based upon the wording, the qualifying part of it, which one do you think is the most correct, right? You're looking at, hey, this one leaves the opportunity for something to be open, right? It contained the word may. It was not an absolute statement, right? So just think about things like the word may, right? Things like that can be very beneficial to understand when you're looking at absolute statements versus a cloudy statement, right? The vague statement actually may be the right choice. So A, B, and C are absolute, and they limit the answer, right? And they're saying, hey, is this an absolute situation? And if it's not an absolute situation, then you actually already know what the right answer is. Pretty cool. All right, here's another example. People with chronic diseases can be described as inevitably in pain, always grouchy, never able to walk, and needing more assistance. So what do you think? Is it inevitable that they'll be in pain? Are they always grouchy? Will they never be able to walk? Right? Can we really say these people are always grouchy, inevitably in pain, or will never walk? Of course not, right? So they need more assistance. So even if you don't know what the question is asking, you might be able, just by good test-taking strategy, actually be able to have a chance at answering the right answer, even though you may not understand what the question is asking. So one of the things you can look at is absolute statements, right? Which of the following doesn't belong, right? All of these had absolute statements. This one did not. Okay, it was the outlier. Okay, there we go. True and false, not something that you'll see on here, but understand that they hide these pretty darn easily. True, unless the statement is false, is the good way to go for a lot of these. Everything about the statement must be true. So watch out for negatives when you're looking at testing is the big point that I want to get through on this slide. So anything where you see which of the following is not included in COPD, which of the following do you not want to do when you're applying non-invasive ventilation to a patient, right? Infrequent, unfrequent, something like that. Those are all negatives that you want to watch out for, and it can change the meaning of the question. It can change the meaning of the statement altogether. So that's just something that mentally, if you see a negative in there, make sure that you're reading the question correctly. Once again, if you see a negative in the question, make sure you reread it, because you might be reading it incorrectly if you did not see that in there, right? If it has two negatives, which sometimes they could do, cross it out because they cancel each other out. Yay! Ultimately, it'll make you understand the statement a lot better. So here's an example. It is never not a good idea to serve people. You'd be like, who wrote this question and why do they have a job, right? So when you're seeing it, it is, and then you sort of mentally cross out never not. So it's saying, true or false, it is a good idea to serve the people. Well, of course, right? So that's one of the things that we'll be looking at in these statements. So if you see double negatives, mentally cross those out. They're just trying to sort of make sure you understand or ask the question in a different way. Absolute statements, usually false. Anything that uses absolute statements, we talked about absolute statements just a bit ago. Watch out for those. If you've seen absolute statements, things are usually not going well. Qualified statements are usually true, where they do sometimes. Which one's the most likely, right? Sometimes these patients, rarely these patients, those are the ones where they'll be like, hey, there's more cloudiness or more gray area here. They tend to go towards those. All right, it is never not a bad idea to sleep late. So what would you do? It is a bad idea to sleep late, right? People in the Middle Ages were always short. So would that be true or false? Right, that would be false, right? Some of the Shawnee Indians were astrologers. Well, it said some, so it's true. All the students have a GPA over 2.5. Right? That's a false, right? Because it used that. None of the scientists believed in God. That's an absolute statement, so there you go. So be smart about how you're working, right? Work from the easiest question to the hardest question. Like I said, if question 1 is this ginormous paragraph problem and it has equations you think to deal with it, and you see the answers, and it all looks like a foreign language to you, if it's stressing you out, skip it. If it doesn't stress you out, do it, right? But if it looks like a foreign language and your brain isn't worked up to it yet, come back to it, right? Select an answer, select A, right? Whatever it is, or D for Derek, right? Whatever it is, and then come back to it later, right? It's okay to come back to it later if you know your pace, right? That's like I said, if you know your pace. You can always come back to it, but yeah, let your brain warm up and then come back to it. Don't get your brain in that stress loop right away. Save the difficult problems for the very last, right? Come back to the questions at the end. This is if you know your pace, right? That's my qualifying statement there, is if you know your pace. And that's why I recommend knowing your pace per question when you're doing these practice exams, right? If you see a question that hurts the brain, skip it, come back to it, or select D, or whatever it is, come back to it, right? But pace yourself in a calm way. Hey, does this question give me stress? Or can I work through this one pretty straightforward, right? And then I can always let my brain warm up on these simpler questions. Maybe you got a couple of recall questions. Okay, now my brain's warmed up. Now I'm in the testing brain mode. And when I come back to this giant paragraph question with all these values, then my brain can actually process that more efficiently. Don't mark anything until you read the whole question and the answers, right? Don't just read the first sentence of a scenario and then just pick an answer, right? Make sure you read the whole question and look at all the answers. And like I said, if you're the type of person that gets lost in the paragraph of this patient scenario, start at the answers and work your way back. Then you know which data to look for when you're going through the big question. So that's only if you're the person that gets stressed when you see that whole scenario question come up. Don't mark anything until you read the whole question and the answers, right? Notice that I put this in there twice. I'm intentional about that. You won't believe how many students or how many people will just see a little bit here and there and answer something, and when in fact there was an all or a absolute statement in there or something like that that made that whole question change, right? There was a negative in there that made the whole question change. Something made that question read differently than what the first sentence was saying it was. So just be careful, right? Does the answer you give fit the question statement, right? So it's asking, hey, which of the following is the best indicator for oxygenation on an adult patient? And it's asking for saturation, PaO2, CaO2, SvO2, right? Those are your 4 options that you're getting. And you're like, okay, so they're looking for oxygenation. So they're not looking for just what's on the hemoglobin with saturation. The venous one is just silly, so throw that one out. That's not oxygenation, that's venous. That's after the body's used it. SaO2 is only on the hemoglobin, so CaO2. PaO2 would be a wrong answer because that's just what's in the plasma. So CaO2 includes both PaO2 and saturation. So the best answer to fit the question of best way to look at oxygenation would be CaO2 in this situation, right? That's what they're looking for. Does your answer fit the question? Okay, so you come to a question and you're like, what? I never heard of this before. They're using some made up words. This is not great, right? Don't let this give you stress. If you see a phrase or a word you've never heard of, they could have made it up don't freak out. As long as you've been intentional about studying and preparing, you should, if you do see a word you don't recognize, it's probably wrong. Why do I have a lot of Julie Andrews things in here? I don't know. But when you're looking at this, this will look at how your logical reasoning or your deductive reasoning is functioning. So if you ignore the strange word, does the question still make sense? And so that's where you cannot let your brain focus on what you don't know. So that's why that's that deficit-based mindset I was talking about earlier. You got to know, hey, what do I know about this question? What do I know about this situation? You cannot focus about what you don't know. So if you see a word you don't know, try to focus on what you do know about the situation, what you do know about the question, right? Can you answer it without knowing what that word means? In a lot of cases, it's probably so. You could. So here's an example. You're treating a patient with this made-up Koop's disease, right? When comparing this drug that's made up to this drug, which of the following would be the most appropriate intervention for this patient? Oh, heavens. Oh, heavens. So we don't know what this disease is, right? And I don't know what these drugs do. Which of the following would be the most appropriate? Oh, heavens. Well, we know D is wrong because it's saying both A and B, so we know D is wrong because this is saying more appropriate and this is saying this one's more appropriate. So they're fighting each other. So I know D is not the right answer. What else do I know? Oh, what else do I know, right? So let's look in more detail. What are some clues? I don't know what that disease is. I've never heard of those drugs before. All these words are made up. It doesn't matter, right? Because when we're looking at this, we know D is not correct because you're asked to choose between those two drugs. The answer can't be A or C because they're the same thing, right? The way that the statement reads. So when we're looking at this, the only logical answer is going to be B. Even though we have no idea what the disease is, we're able to eliminate the other answers, right? So if you do see a situation like that, and if you do, then you know what to do. You need to look through it logically. Okay, I don't know what these drugs are. I don't know what this is, but what are the answers sort of doing? What doesn't belong here? Hey, D says, you know, both of these, but both of these are arguing against each other, so it's not that. This other one, statement C, was saying the same thing, so we know it's B, right? Don't freak out when you see unfamiliar terms, right? Difficult questions, remember priorities. Prioritize the answers in some order. Most important, best answer, last first, so on and so forth. Use your deductive reasoning when you're looking at this. Know what you do know. Like I said, focus on your assets. Don't focus on your deficits. What do I know about this situation? Right? Keep your brain in that asset-based mindset. Compare the answers to each other. All right, so some more. If all the above is a choice and two choices are correct, all the above is most likely the right choice. Just be careful with this, right? A lot of people will just go ahead and blindly pick all the above. Just read through it slowly, but your odds of all the above being correct increase if at least two of those things are correct. So if one of the choices is wrong, all of the above can't be the right choice. I'm just saying statistically, if at least two of them are there, that all of the above becomes more realistic to your brain. But then if you read one that's not a true statement, then you know it's not all the above and you've eliminated that as an answer. So paragraph questions, like I said, a lot of times this will give people anxiety. If it does give you anxiety, then I recommend doing the reverse maze where you start the finish line, go back to the start line. If it does not, if you read a paragraph question, if you see a paragraph question and it does not give you anxiety, go through it, do the question, right? Have fun with it. But if it does give you anxiety seeing a whole scenario and all that stuff, then I suggest that you might relieve some of the stress of reading through that whole paragraph by looking at the answer choices first and then read the paragraph. Like I said, I only recommend this if those paragraph questions stress you out. If they do not, then don't worry about it. Go as normal as you usually would. All right, here's an example. Okay, a 56-year-old female, 60-pack year history, is on flow entrainment mask at 40%, concentration set at 10 concentration set 40% oxygen concentration. The device is set at, here, let me put a comma in there. The device is set at 10 liters a minute. X-ray shows patchy infiltrates, bilateral lung volumes, low lung volume. She has a loose productive cough. You're like, where is this going, right? So some people are like, okay, I get this. Okay, I got a picture of my brain. Now I'm ready to answer it. Other people are like, I don't know what that was, what language that was that I just read. So if it stresses you out reading something like this, where you can't comprehend what this whole thing is saying or the picture it's trying to give you, then this is the type of situation where I'd recommend reading the answers first, then coming back to it. But if you can read this and get that picture in your brain, then go ahead and go for it. Right? Like I said, these are just different ways of approaching it for different types of people. Right? So this is where I'm like, oh, do I use biphasic ventilation, because they can't say BiPAP. Do I use biphasic ventilation, right? Do I include airway clearance therapy, volume expansion, ABG? What do I do here? And you're like, okay, what's the question really asking? Do I need to look for, so option one is looking for someone that's working hard to breathe and hypercarbic, most likely. Option number two is looking for someone that needs to clear a lot of secretions. Option number three is looking for someone that has atelectasis and hypoxic. And option number four is trying to see if they meet indications for an ABG. So I should know the indications for an ABG. So now that I know what my options are, I can go through and extract. Is there anything in here that tells me they need BiPAP? Is there anything in here that tells me they need airway clearance therapy? Is there anything in here that tells me they need volume expansion? Is there anything in here that gives me indication for an ABG? So then I can go back and reread it and be like, okay, low lung volumes, thick copious secretions, right? So then I can go back and read it and be like, oh, okay, now I can have a lot better approach to this, right? So when we're looking at this, we can have a lot better way of managing it, right? Especially if you get anxiety over these types of questions. All right, here's another example. You're asked to evaluate a 71-year-old male, 175 centimeters tall, weighs 119 pounds, 70-pack year history, wheezing and crackles, multiple blebs, so this sounds like emphysema. On the x-ray, strong pharyngeal gag reflex. Noted, this is the blood gas. These are the current vet settings. Which of the following should be done at this time? Now, if you are okay, you see this blood gas and you're like, okay, they're in a respiratory alkalosis or acidosis, right? A compensated respiratory acidosis. Are they on oxygen? It doesn't say. Great. Vent settings. Oh yeah, they're on vent settings. Okay. They're on 50% oxygen, so it's a corrected hypoxemia. Which of the following should be changed at this time? So increase the tidal volume. Well, I know that their pH is compensated, so I know that's not going to work. Increase the FiO2. Well, their PO2 is corrected, so I'm not going to do that. Decrease their tidal volume. Well, they're already in a compensated acidosis, so I don't want to change that. Consider a wean protocol. Well, yeah, they would meet a wean protocol here because, remember, everything about their blood gas is baseline here. Right? Vent settings are minimal, 50%, 5 a peep. So this would be a situation where if I'm just looking at the answers and I sort of know where they're going at, hey, I know that this is pretty much saying, look at the blood gas. Right? Look at the blood gas. The blood gas doesn't indicate, the answers are saying look at the blood gas. The answer doesn't indicate, when you look at the blood gas, it doesn't say I need to change ventilation. It doesn't say I need to change oxygenation. So therefore the only one left over is the correct answer. So if, like I said, these whole paragraph questions give you anxiety, you might want to consider the reverse maze strategy, which I don't know if that's an official term for it. But what is the question going? Where is this question going? And then I can go back at the question, and even though it does, this ABG does make sense with someone that has emphysema, all I needed to really look at was this, and then make sure that these settings were minimal. And there you go. I verified that my answer is correct. All right, eliminate any wrong answers like what we just did. Difficult questions, eliminate 2 answers if you have no clue ultimately. Any calculations, estimate the answer before the calculation. This avoids calculator problems. Oh heavens. Because now I think you guys have the option of calculators. So make sure you mentally sort of be like, does that answer make sense, right? If their P big AO2 is 300 and their little AO2 is 50, then I know that their PF ratio is not going to be 500. I know their PF ratio is going to be very, very low. And so that's looking at, does this answer make sense ultimately before you do the calculation, because you can lose yourself in a calculation. So think about what the answer most likely is going to be. I know that a P big AO2 is huge and their P little AO2 is very tiny, so that gradient or that ratio is very, very small, right? The gradient's huge, but the ratio is very, very small. So if you're looking at the 8A ratio, so when you're looking at this, think about what would the answer most likely be, then do your calculation, right? Then see if you'll know if you made a calculation error somewhere in there. So are all the values normal in the question, right? Pick the normal answer. I already gave you guys that example earlier. If your answer is not even close to one of the choices, step back, blink your eyes a couple of times, right? Do something that gets your brain off of it. Squeeze your hands, make a fist a couple of times, right? Shake your shoulders, right? Shake your hands, right? Do something that sort of gets your brain reset and then go back at it again. Usually, am I using the right equation? Did I multiply by 10 when I didn't have to? Did I do an arithmetic error? All right, here's an example. Which one is the best method to calibrate a pneumotac on a body box pulmonary function device? And this was an exact question from my CRT exam. Well, not exact. I can't use the exact question, but it's pretty much the exact question. An explosive decompressive device, sine wave rotary pump, a 3-liter super syringe, and a copper heat sink. Oh, heavens. All right, so this one's sort of a recall. It's not really an application. I don't remember much about this. How do I calibrate a pneumotac on the body box? Well, the pneumotac looks at volumes and flow rates, right? So it has nothing to do with the copper heat sink, so I'm going to eliminate that one. Sine wave rotary pump sounds really cool, but I haven't ever really covered that in school, so I'm going to cross that out. Explosive decompressive device sounds like it's more like a peak flow or FEV1 type thing, but it's not really looking at like flow rates. It's just looking at just like a fast flow rate. So it doesn't vary flow rate, so I'm going to cross that out. So therefore, my answer has to be C. Why is that? Well, remember, when we're calibrating these, you have to do it at a slow, medium, and fast rate to make sure the pneumotac is calibrated for a slow flow rate, a medium flow rate, and a faster flow rate. Now, some of the modern ones, they do this themselves. You don't actually have to manually do this, but that's a whole side note there. But when you're looking at this, like, okay, how do I look at the best method? Some of these look like they're foreign, right? Like an explosive decompressive device or a sine wave rotary pump. These look amazing, right? And they do. But what do I know? What do I know, right? Because I don't know. I could focus on, I don't know what this is. I don't know what this is. I don't know what this is, right? I could focus on the ones I don't know, or I can focus on what do I know about the pulmonary function body box? What do I know? What have we covered? What do I know about this device? Therefore, I have a lot better calm state of mind to find the right answer. I hope you guys see the value in that. Right, biological control, not the right answer. Okay, so here is another example. This is one of my favorite ones. So this is, hey, calculate the ADA gradient. Here are the vent settings. Okay, so I know exactly this is an equation. Whew. Okay, asset-based. I got my equations down. I definitely know my alveolar air. So here's a shortcut for the alveolar air if you don't want to do the whole thing. You take your FiO2. Let me put this on. Remember at NBRC hospitals at sea level, I'm going to take FiO2 times 7, because it's 760. Then I'm going to take whatever their CO2 is plus 10. All right, so I'm going to do this one first. So if I have an FiO2, let's see, what is my FiO2? 8 times 7. Right, and then I'm going to take my CO2. My CO2 is 73 plus 10. Right, so hopefully you guys can read that. So 7 times 8 is 56, right? And I put the 0 there because, right, that's what we're doing mathematically. And then 73 plus 10 is 83. So then I just subtract, which equals 560 minus 83 should be, my math might be off, 477. Thanks, brain. 477 millimeters of mercury. Ultimately. So I'm going to take my P big AO2 minus my little AO2, which is 56, so 477 minus 56, I believe is 421 millimeters of mercury. So that's my A to A gradient. Oh heavens. So when you're looking at these answers, you're like, great. I got 418, 486, 130, I know that one's not right. 300, I know that one's not right. So when I'm looking at this, I see a huge level of CO2. I see a big FiO2 here. Just by looking at this logically, before I calculate anything, which I should have done beforehand, sorry, which one of these would make sense? Well, A and B don't make sense. Those are big A gradients, but we see that this person's on a lot of FiO2. Their CO2 is sky high, so that means that that gradient's going to be even bigger. So I know it's going to be either C or D. So now I got a 50-50 chance at answering this question correctly without ever having to even calculate it so far. Right, so now I'm looking at which one of these is closer to my shortcutted alveolar air minus, well, C is just asking, hey, did you subtract the CO2 at all? Because if you didn't, then you would think C is right. But if you did and you knew the equation, then you were pretty darn close to D, which would be your answer here. And I hope this is helping you a little bit. So they'll put one in there to see if you made a tiny mathematical or arithmetic error, but you should have at least a 50-50 shot there. So think about it that way. This is the shortened version of the alveolar air equation, and I actually used to use this at the bedside, don't tell anyone, as well. Although in Colorado, I would do FiO2 times 6 instead of FiO2 times 7. Because we were at 630 usually at Swedish. So I do FiO2 times 6, add 10 to the CO2, and then you still do your math that way. So you can do pretty much a shunt equation at the bedside. So what they might ask you, and later on, and I want to cover this now, is they'll give you a shunt equation. Hey, what's the shunt for this patient? And they won't give you the, some of the information to calculate. Like, let's say they don't give you a hemoglobin level. Well, how do I calculate CaO2, CCO2, and CVO2 if I don't have a hemoglobin level, right? You could either assume it's normal, or you could calculate the A-to-A gradient, which in this case is 421, divided by 20. So there's two ways to do this. You either take the A-to-A gradient divided by 20, or for every 100 in the A-to-A gradient, you start with the baseline 5. So let's do both of them. So A-to-A gradient divided by 20. So this would equal, I want to say about like 21%, something like that. That's your shunting. So they're shunting 21% of their blood. So that's one way to calculate a shunt percent, is you take your ADA gradient over 20. So you take this 420 over 20, and that would be, I'm guessing, around 21 or so. Or you could do every 100 in the ADA gradient. So I have 400, right? So 100, 200, 300, 400. So let's say I have a baseline 3% that I have anatomically that's left over from fetal circulation. So for every 100 in my ADA gradient, I'm going to add 5%, right? So this is my from birth 3% here. So this means I got 5, 10, 15, 23% shunt. So there's two ways. You can either do your A to A over 20, or another short way to get to your shunt is for every 100 in your A to A gradient, add 5%. Hopefully you guys can see that. So I started off with a baseline anatomical 3%, and then for every 100 in my A to A gradient, I added 5%. So that means that my shunt would be around 20 to 23% overall. So they're pretty darn close mathematically. So that should get you pretty close to the answer there when you're looking at this. So here we just did a whole shunt equation just by looking at their A to A gradient. Isn't that crazy? So on your patient at the bedside in the hospital, you can make event change, do a blood gas, and see if their shunting increased or decreased just doing these sort of bedside ways without having to draw venous blood and all this other stuff. Is that other way going to be more accurate? Absolutely. Simultaneous venous and arterial gas from a central line? Absolutely. Going to be more accurate because it's directly measured versus more of just a calculated estimation. But this will sort of get you in the right area if your shunting generally increased or decreased with those changes on that patient. Hopefully that makes sense. All right, the following information was obtained for a respiratory therapist. Patients on 4 liters. Which of the following was the CO2 for the patient? Oh, heavens. So we got a venous blood gas and an arterial blood gas. Well, does the CO2 include venous values? No. So mentally, don't even look at those. All right, so CO2 of the patient. Should I know what that calculation is? Absolutely. They might give you a question, be like, which of the following is the calculation for CO2? It's possible. However, when you're looking at this gas, you're like, well, what are the factors in there? Hemoglobin, they don't give me hemoglobin, so I gotta assume it's normal. I have a really good saturation. I have a really good PO2. And remember, the PO2 and the saturation are the big key factors besides the hemoglobin level in here. So when I'm looking at this, these values look normal going into it. So the question, what is the question really asking me? It's, hey, we got some normal values going into this. I'm not even going to give you hemoglobin, so you got to assume it's normal. Which one of these would represent a most normal CO2? So this is actually more of a recall question, even though it's in the form of an application question. So we know 12 is low, 15 is normal for venous, so we know that's not right. So 22 and 18. So I know a normal CO2 is 20 volumes percent. 22.13 would be higher than normal. Well, we don't have a saturation of 100 and a PO2 of like 300, right? We have a pretty much normal PO2 and a normal saturation. So which one of these is closest to normal? Right? That's what you're looking at here. All right, patient obtained 4 liters cannula. Which of the following is the shunt percent? Oh, heavens. So what do you know about the whole shunt situation? Oh, well, let's look at this logically. What do you see here on this blood gas? Do you see them on a lot of oxygen? Do you see this patient having incredibly high CO2s? Do you see them having incredibly low PaO2s? Huh. These all look to be sort of within normal limits. Same thing with bicarb. Saturation should be anywhere between 65 and 75 for venous blood. So all this is looking normal. And they're on 4 liters a minute. So do I think it's C or D? Probably not. So now I just need to pick between a 6% shunt and a 12% shunt. So if you want to, you could do that. You could do, so what was it? 36 would be your FiO2. So let's do 36 times 7 minus, what was the CO2? 45 plus 10. This be 55. And then 36 times 7 is 252-ish. 252 minus 55 should be 197. That makes sense, right? So we got 197 millimeters of mercury here. So when we're looking at this, we see that we got it P big AO2 197, a P little AO2 of 93, so 197, and then 93. So how much difference is there between my P big AO2 and my P little AO2? So this would be 104. And I could be wrong here. So my ADA gradient is pretty much 100. So if I have a baseline 3% shunt, and I add 5% for every 100 in my ADA gradient, this would be like a 8% shunt. So, oh heavens. So where do I put 8% between 12 and 6? Oh heavens. Well, what if I did my ADA gradient over 20? Oh, 104 over 20. So if I do 104 over 20, this equals 5.2, which would be a 5.2% shunt. So we're actually doing the ADA gradient over 20 closer to version A here. So hopefully sort of see these two techniques. I use them interchangeably, that's why I remember it. So at the bedside, I usually just do the ADA, so anywhere between a 6 and 12% shunt. Clinically, that's still anything less than 10%, remember, is not significant. And an ICU patient, the more FiO2 they're on, the more shunt you will have. That's a whole different physiology lecture than what we have time for here, for sure. But you can sort of see where both of these ways of figuring out your shunt could come in handy. More examples. Which one of the following is a small volume neb concentration for albuterol of 2.5 milligrams in a 3 ml solution? This was almost the exact question that I got on the board exams that I may have seen one very, very similar to this every time I've taken them. All right, so oh heavens. Whew. Okay, so this is either a calculation question which you could do, right? You could do your drug calcs here. That's okay. If you're a calculation person, go for it. But if I know that a normal dose of albuterol is 2.5 milligrams and the normal volume is a 3 ml solution, then I'm looking for the normal concentration. So which one of these is the normal concentration of albuterol? That's what the question is really asking. So me, because I know those are the normals, I'm going to pick the other normal. Did I need to calculate anything? Did I need to stress my brain out? No, because I spent my time preparing by having one study session or a couple study sessions going over normal values for everything, not just for equations, right? But also for things like, hey, what's the normal dose for this? What's the normal concentration for this? What's the normal volume for this, right? So yeah, you could calculate this. Go for it if you want to. But if you know your normals, and this question is like, do you know what's normal, right? They might be trying to trick you into calculating it. I'm not sure what the mentality is there, but they're pretty much looking at normal. So like I said, knowing your normals, big thing, right? Because they could be asking normals, and you might be able to bypass doing this whole dosage volume concentration thing altogether. Okay. Usually your first answer or first choice that you picked is most commonly correct. So unless you're sure of the correction, don't change your answer when you're going back through it. A lot of times I did, but that's because I usually read a question the wrong way. I missed a statement. I missed a qualifying word, or I missed an absolute word, right? That would change the question. So usually your gut, your first instinct is correct, right? You guys know that by now. Key phrases, key words, key values, going to be important to pay attention to. Make sure you know your normals, like I said in that one that we just did with the albuterol concentration, right? Make sure you know your normals. Things like that will save you time and stress when you're going through these things. If you do see words that you don't know or something like that, use hints, right? What do I know? Right? Just like the PFT question about the body box, calibrating the pneumotac in the body box. So what do I know? Well, I know we covered the 3-liter super syringe a whole heck of a lot. That must be important. And we're looking at something that measures flow rates. So I need something that will do different flow rates. Okay, the other things don't look like they'll do that really well, right? So that's where you're looking at hints, right? All right, look at the values and the vital signs before reading the situation. Hey, you see a patient in respiratory acidosis with normal oxygenation, or a patient in respiratory acidosis with severe oxygenation, you know the answer is going to be increased ventilation by some manner or another, right? So sometimes looking at the vital signs, looking at the hemodynamics, looking at the ABGs can actually give you a hint of what to look for. As far as the answers go, or before you even read the situation. Like I said, if you're a person that gets stressed by reading this whole paragraph and you get lost in the information, like I said, try doing the reverse maze where you read the answers, A, B, C, D, E, right? And then you're like, okay, I know they're looking for this. Or, hey, they're in an acute respiratory acidosis with severe oxygenation, so I know I'm going to do something that involves assisted ventilation, because that's the first life function is ventilation before oxygenation, right? So that's how I know which one to sort of look for there. So like if you do have that stress that goes along with those paragraph questions, that would be my suggestion. So if you're a person that doesn't, you paints a good picture for you, don't worry about doing the reverse situation. You got it. You're good to go. Keywords, usually you'll have a lot more confidence doing this way. And this can also make you more, as far as your time and your pacing goes, you might actually be able to save some time here if this helps you go faster. Now, if you do just fine reading the paragraph, having a mental picture, and answering the question, don't worry about it. All right. If you know what the answer is after slowly reading the question, and then you've seen all the keywords in there, then pick it, right? If you have eliminated 2 answers and you're looking at the other 2, which one's more appropriate than the other? Is there a qualifying statement? Is there an absolute statement? Is there something like that in there that would make one of them better than the other, right? If you have no clue what the answer is, have a slight inkling, then go with that, right? Go with what your gut would think in that situation. If you have no clue, no feeling at all, then always pick the same letter. So let's say I always pick letter D for Derek, all right? Or whatever letter you want to pick, right? For all those questions, you have no clue. The question is completely a foreign language. Mathematically, if I always pick that same letter, I will get more correct in all those ones that I have absolutely no feeling on than if I picked random letters. Okay, so go with your gut more than go with the set answer or set letter, right, situation. So like I said, try to eliminate if you can. If you can't, go with your gut. Go with what makes logical sense. What makes logical sense with this? If the whole thing looks like a foreign language to you, then pick that same letter, right? Or if you're trying to skip questions and come back to them, write down on the piece of paper which question you skipped, so you know to come back to it and think the question, right? Re-answer the question, but pick that same letter the whole time. If time remains after answering all the questions, please review your difficult questions. That's why some people, that's why I recommend knowing your pace, but if you don't know the answer, then pick a letter, move on to it. You can always come back to it. So if your time runs out for some reason and you don't have time to go back to all those ones, then you'll at least have something filled out. And if you always pick that same letter, then you'll probably get some of those right? If time remains after answering all the questions, go back, look at all the difficult questions. Your brain's probably warmed up by now. So did you set up the equation correctly? Did you make all a small error in your math if your answer didn't come out close to anything there? Did you not see a word in there that makes it change? You guys have all done this on your tests. Did you see any other questions that may clue you into what they're asking there? Did your brain get warmed up, or did your brain get jogged? Did your memory get jogged? Did you somehow come to a light turn on in your brain after seeing other questions? Now, okay, now I remember more stuff about this, right? So remember, your first guess is usually right as long as you read it correctly the first time. If you don't know an answer, then if you don't know what it's talking about, don't pick it, right? You're dead to me question, you're dead to me answer, right? If you don't know that answer, if it uses things like explosive decompressive device, right, and you've never heard about it or talked about it much at all, then that answer is dead to you. Don't pick it, right? It's not a viable option. So once you're sure of an answer, it no longer exists. Move on. Don't let your brain dwell on that previous question. If you want to write down on a little piece of paper that's with you to come back to question 71, then you can do that, but let your brain reset and focus on the next question. You cannot let your brain focus on that previous question. That's why I just write that little note down, right? Question 71, question 23, right? All those things, just write them down. But the next question, fresh brain, fresh perspective. Once you see difficult question and select and commit to the answer, it no longer exists. Don't let your brain go into that stressful situation. Move on. You could, like I said, write down the question number, and then come back to it later on. Two answers are opposite, then one of them are probably correct. That's just the general strategy altogether. This person will always have a chronic non-productive cough. This person will never have a cough whatsoever. Well, they're chronic bronchitis, so they will always have, right? Or they will most likely, I should use the gray term there, most likely have a chronic productive cough, right? So those two statements are opposite of each other, most likely and never. One has an absolute statement, they never have a cough, or the other one has a. So therefore you sort of can see there's two answers that oppose each other. Most likely you have that 50-50 shot there. Okay, which of the following would be the best diagnostic test for interstitial lung disease? Lymph needle biopsy with endobronchial ultrasound, open lung biopsy, chest MRI, and air radiography with contrast. Have you ever heard of something called air radiography? No, it is made up. Eliminate that one. Interstitial lung disease, a chest MRI. Well, no, that's not going to work because it's not really good at looking at thoracic images. What do I know about ILD? I know that to diagnose it, I need a biopsy, right? Lymph needle biopsy or EBUSs, from what I do know about EBUSs, they're sort of looking for cancer and they're looking for things like that, especially if you're going to the lymph nodes. So I know that's not the answer. Therefore, I eliminated A, I eliminated D, I eliminated C. So the only correct answer, based upon what I do know, is an open lung biopsy. Even if I don't recall that that is the best way to do it, what do I know about EBUS? What do I know about chest MRIs? Hey, they don't give you quality images usually. This is something that's completely made up because I've never heard of it. Of course, I made it up for you guys. And then this, what do I know? Well, I know this is looking for usually cancer and things like that. So I know that's not looking for this. So therefore, what remains must be the logical answer. While in the NICU, the RT notes that the closed system suction pressure is set at max on the vacuum. Which of the following should the RT do at this time? Okay. Negative 80, positive 80, 120, negative 25. Oh heavens, which one of these would work? They're all millimeters of mercury, but I have two that are similar. Okay, well that sort of crosses off these guys. Now what do I pick between these two? Well, is it negative pressure or positive pressure? Right? So therefore you actually know which one's the right one now. So you know which one, they're two opposites, which one would be representing the negative or positive pressure. Right? In order to perform a quality control test of the body box, which of the following will be used? Rotometer, a mercury barometer, a sine wave rotary pump, or an isothermal lung analog. Oh heavens. Which of the following would be used? So what do I know about the quality control of a body box? Oh heavens. Okay, here's another example. Closing off all the ports with a free breathing valve, water will help me determine dead space, compliance, resistance, or conductance. So I'm looking at a free breathing valve with water, and so I want to see what I'm looking at with this patient. So if I want to see a free breathing valve with water, I'm looking at volume. So if I'm feeling something with volume, what I'll be looking at? Well, compliance, that's not just a volume thing. Conductance, resistance, that's not just a volume. There's other things in there. So the only answer here is going to be dead space, right? Which of the following is the formal value for end tidal capnography? Ooh. What do I know about end tidal? I don't remember this from route memory. Well, I know end tidal CO2 should be lower than what PaCO2 is. Well, normal PaCO2 is 35 to 45. So I know I'm not going to answer 45. These two are too low for it, so my answer then is going to be C. Which of the following would be a normal response to stress testing? Ooh. Systolic pressure less than 100. That doesn't sound great. Diastolic pressure from 60 to 70. ST segment depression. Hopefully that's not a normal response. Or heart rate greater than 120. Which of those following would be a normal response to stress testing, right? Normally when I'm stressed, the heart rate's going to increase. So yeah, we got a couple of these that are looking bad. But diastolic pressure 60 to 70 is usually low. Systolic pressure less than 100 is low. So those are both hypotensive, which would indicate more like heart failure. ST depression looks at injury. So there you go. All the following are appropriate goals of pulmonary rehab except increased physical activity, decreased resting heart rate, increased spirometry values, and decreased hospitalizations. Well, what are the appropriate goals of pulmonary rehab? Do I want them to have better physical activity, better quality of life? Okay, that sounds like it could be good. Decreased resting heart rate, that indicates more physical activity, less hypoxic issues. Okay, that could be good. Increased spirometry values. Is there a chance that their spirometry values will increase with all this exercise and everything like that? Not likely. Decreased hospitalizations, absolutely. We're going to be more trained, our body's going to be healthier, we're going to be more efficient. So therefore, all the following are appropriate goals except, right, this is your statement there, right? And we figured out which one doesn't belong. While performing a bronchoprovocation, we're doing a methacholine challenge here. Methacholine, it went from 3.5 to 2.9. What should be done at this time? So what do I know about this? Well, I know that my PD20, I'm looking for a 20% change. The question is, do I have a 20% change? So that's what we're looking at here. Is there any indication for oxygenation? So if I didn't hit a 20% change, then should I continue testing? Absolutely. If I hit my 20% change, then I would start to reverse them. Perform an FBC, that's what we just did. So it's either continue testing or start reversing them. So we do 2.9 over 3.5. That's an 82% change, or sorry, 82%. So we haven't dropped 20% yet. So then we would continue the testing. We'd go on to the next dose. Right, so once we hit less than 80%, that would be a drop of 20% or more, then we would know. So this answer, we would continue testing. All right, this one. While performing a metabolic study on a chronic patient, the following is collected. Oh heavens, that's a lot of numbers. I'm feeling stressed out. What do I do? I'm going to look at the answer. Okay, the answer says I'm looking for a shunt percent. Well, I know a shunt is CC minus CA over CC minus CV. Oh heavens. So not all the stuff is in here to do this. I don't have my CCO2, my PBigAO2. Oh heavens. So I am going to do my ADA gradient and see what happens. But looking at this, before I do any of that stuff, what's my CaO2? Is that normal? Yes, 20 volumes percent is normal. My CVO2? Normal is 15 volumes percent. That's really good, 16.4 volumes percent, right? So when I'm looking at the shunt here, even though they're on a lot of FiO2, what's really going to be their shunt when we're looking at this patient? So logically, when we're thinking about this just logically, my CaO2 cannot be higher than my CCO2. So remember, CCO2, tissues, so CVO2, CaO2, so this is what's in the artery, what's in the vein. The tissues would be like your A to B gradient, so on and so forth. And then your CCO2 is the capillary content in your pulmonary capillaries. So my CaO2 is downstream of what's in my lungs, and my CaO2 therefore cannot be higher than what's in my what's in my capillary content, unless we're in pulmonary bypass on ECMO. That's a whole separate thing. But so when we're looking at this, we see that so I should have a normal CCO2, a normal CaO2, and a normal CVO2. Which one of these is a normal shunt? Well, 10% is considered within normal limits, but looking at these values, without even doing the equation, which one's most likely the answer, right? That could save you time and stress. You could always go back and calculate it, especially because calculations are fun. But there you go. All right, another example. Patient from the pulmonary lab. Oh, that's a lot of numbers. What's their A to B gradient? Oh, heavens. All right, so I could calculate this. Got a couple that are pretty close to each other. So when we're looking at this, my CVO2 is 14.4 volumes percent. So I don't have to calculate CVO2, I just need to calculate CaO2. So hemoglobin, is that normal? Saturation, is that normal? And PaO2, is that normal? All those are looking pretty normal. So my A to V gradient is going to be pretty close to normal. What's a normal A to V gradient, if you guys remember? So just based upon logic, if you want to calculate this, you can. And I wouldn't oppose you for doing that, but I know my CVO2 is almost normal, almost perfect, right? Normal CVO2 is 15 volumes percent, and everything going into that equation of CaO2 is almost perfect. PO2 of 90, good hemoglobin, good saturation. When you're looking at that, you're going to come out, if you do the A to A gradient, pretty close, or A to V gradient, sorry, pretty close to about 5 volumes percent. So this is just based on what do I know, right? So if you don't remember the equation, that's okay. But if you remembered your normals, then you would actually be okay for this situation. Interesting. While collecting specimens during a bronch, the patient gags each time the scope is advanced. What would you do? Oh, heavens. So benzocaine, lidocaine, nervocaine. I don't even know what that is. I don't think that's the right answer either. So I'm in between benzocaine and lidocaine. Ooh, a spray or lidocaine injection. Ooh, they're gagging. So which one, an injection or a topical spray, would be appropriate for the back of their mouth? Gagging, not coughing, gagging. Yep, I think I know the answer, right? Hopefully you guys are starting to get the hang of all this. Right, so when you guys are doing this, like I said, practice, practice, practice. Not only studying and reading the material, look at the content outline of the NBRC. Take the test like you're taking the real test. Make sure you plan and practice appropriately, like you're practicing like you're actually taking the test. Make sure when you're practicing a whole study session where you're not only doing equations, but where you're applying the equations, right? I need you guys to be intentional with how you're going to prepare for this test. That is the best way of looking at success. You cannot give up. Start practicing now. 10 minutes a day, or I recommend 45 minutes, but 10 minutes a day is worth 9 hours the night before, is the saying, right? So make sure that you start planning out now. Make sure you start planning out which ones you're going to focus on calculations, which ones you're going to focus on all the normals, right? Make your worksheets, make your plan. Make sure you not only read the content that you need to read, but you also recall and apply that content you need as part of your studying. And then also make sure that you're taking care of yourself, that you have that plan ready to go.